Hello, and welcome to another segment of Let's Get It Straight. Today's topic is dengue virus, more commonly stated as dengue fever. We're hearing a lot about it in the news, and a lot of it tends to be somewhat alarming. This virus is not new to the United States. It's been here since 2010. So let's straighten some things out. I want to give you some very basic information that I think and hope will be helpful to you in your day-to-day work. The causative agent for this virus is the Aedes mosquito, and it's the female Aedes mosquito. It is also a mosquito normally present in some areas within the United States. The transmission for this virus is through the bite of an infected mosquito. So it is not communicable person to person. In order to be at risk for acquiring this virus, you must be bitten by the infected mosquito. Having said that, if a person infected with dengue happens to be pregnant at the time, they could pass that virus on to their fetus. The incubation period, meaning the time following the bite for the onset of signs and symptoms, can be up to 2 weeks, but generally signs and symptoms will appear within 3 to 5 days of the bite. Signs and symptoms for an individual who may have acquired dengue virus. Patient will present with fever, aches and pains, nausea, vomiting, and a rash. It is interesting to note that 1 in every 4 persons infected with dengue virus will have no signs or symptoms of this disease. And there are actually 4 different dengue viruses, which means you could get infected with one, recover from that illness, and have lifelong protection, but you're still at risk for acquiring the other 3. How long might a person be sick with dengue virus infection? The average is between 3 and 7 days. Now, there are 3 phases of illness with this infection. The first is termed the febrile phase, and it lasts between 2 and 7 days. Other symptoms may appear at this time: severe headache, retroorbital pain, myalgia, petechiae, and bleeding gums. The second phase is referred to as the critical phase. This is really where fever begins to subside, and this period of time lasts from 24 to 48 hours. And basically, we will begin to see improvement in this phase. However, some individuals may go on to develop severe dengue infection. The third phase is called the convalescent phase. Here, there is definite improvement, but along with it, one may see the rash become puretic, and the outer layer of the skin may take on an appearance of peeling. So I had mentioned severe dengue. 1 in every 20 persons with dengue will go on to develop severe illness. And this is simply called severe dengue. Severe dengue presents with plasma leakage, shock or fluid accumulation with respiratory distress, and severe bleeding and or organ impairment. So who is at risk for developing severe dengue? First of all, infants under 1 year of age, pregnant people, adults greater than 65 years of age, and people with certain medical conditions. So what might those be? Well, first of all, if you've had a previous dengue infection, you are at increased risk for developing another total type of dengue infection, of progressing on to severe dengue. We mentioned age, specifically children. Medical conditions such as asthma, sickle cell anemia, and diabetes can put individuals at increased risk, along with hypertension, renal disease, as well as cardiovascular disease. Currently, there is no treatment available for treating dengue fever. Antiviral medications are not recommended. So it is very important to watch for any early signs of shock and begin initiating intensive supportive therapy with IV fluids, and that this can reduce the risk of death among patients with severe dengue to less than 0.5%. For those without symptoms that would suggest severe dengue, we offer only supportive care. Travel history. How many times in our sessions of Let's Get It Straight have we talked about the importance of getting travel history on patients for many different illnesses? This needs to be a routine part of patient assessment. So the majority of cases of dengue fever are the result of travel, because most dengue cases occur in tropical and subtropical areas. The more frequent cases come from the Caribbean, South and Central America, Southeast Asia, and the Pacific Islands. The CDC actually has issued a travel alert with regard to dengue virus for Brazil and Cuba. The highest number of cases occurring in the United States, and we've had a total thus far, and this is as of July 10th of 2024. We have had 2,559 cases recorded. 200 were in the New York, New Jersey area, 218 in Florida, but as you can clearly see, the highest number is from the U.S. territory, Puerto Rico, where they have reported 1,700 cases. These are the largest case numbers we have seen since dengue was first noted in this country back in 2010. But what is our risk for acquiring dengue fever here in the United States? And the CDC states that the risk of widespread transmission in our country remains low. There's been limited local spread of dengue reported in Florida, Hawaii, Texas, Arizona, and California. Remember, these mosquitoes that can cause dengue are present here in the United States, and that is how we would have local transmission of this illness. An infected mosquito can bite people and pass on this infection. So how does local spread occur? As I previously mentioned, most of our cases in the United States are travel related. So when a mosquito here bites someone who has dengue virus infection, that mosquito can then transmit the disease to other individuals that it bites. So what about prevention? What do we need to be doing? There has been available a vaccine for dengue fever called Denvexat. It has been recommended for children ages 9 through 16 years of age. It requires testing to prove that an individual had previous infection to be eligible for the vaccine, and was required to be given in 3 doses. Now, unfortunately, in June of this year, 2024, the CDC has notified the vaccine committee that U.S. residents no longer have access to this previously approved vaccine. The reason? The company states there has been low demand for their product. Here at a time when we are seeing cases increase across the globe. Well, what about the status of other vaccines? Well, the World Health Organization has approved a second generation vaccine called Qdenga for use in Europe, but nothing has been stated about whether or not this would be made available in the United States in 2024. So stay tuned. So what about EMS? What do we need to be doing in the time of cases emerging of dengue fever? Well, first of all, going back once again, is stressing the importance of getting travel history. The majority of our cases of dengue virus in the United States have been travel related. So, recommendations for healthcare providers: that we want to be on the alert for dengue in patients with fever and recent travel, described as within 14 days of the onset of illness, to areas where we are seeing dengue transmission. We also want to be aware of the fact that there can be locally acquired dengue cases among patients who present with fever, thrombocytopenia, leukopenia, aches, pains, and rash. Specific to areas where we know this type of mosquito is present. If you have a suspect patient for dengue fever, we want to specifically observe for warning signs that would include abdominal pain or tenderness, persistent vomiting, clinical fluid accumulation, ascites, pleural effusion, any mucosal bleeding, lethargy or restlessness, progressive increase in hematocrit or liver enlargement greater than 2 centimeters. We need to watch for this because this could be a sign that a patient might be going into severe dengue fever. If we are going to transport a patient suspect for dengue or confirmed with dengue, remember this is not a communicable disease. We would have to be bitten by the infected mosquito to be at risk. So we're just going to use standard precautions and routine cleaning of high contact areas. Remember that high contact areas are considered areas in which the patient was in direct contact with, and areas and equipment that you were in contact with when caring for this individual. We can use any EPA registered insect repellent that contains DEET, 20 to 30%, or other ingredients that may help keep this type of mosquito away. We want to make sure that we cover skin outdoors, especially at night when the mosquitoes are more active. And these mosquitoes can be inside as well as outside. Around the station, we want to make sure that we remove any standing water, buckets of water, bird baths, anything that would hold water and become breeding ground for mosquitoes. Keep mosquitoes outside of the workplace by repairing holes in screens and keeping windows and doors closed if possible. Now the CDC is responding to the increased cases of dengue fever here in the United States. They are actively implementing strategies to address this increase in cases, to include launching a program-led emergency response, which was activated on April the 8th of this year. They'll also be providing regularly scheduled monthly situational updates on dengue to partner stakeholders and jurisdictions. Laboratory capacity for testing for dengue is being expanded. And CDC is collaborating with state, tribal, local, and territorial health departments to strengthen dengue surveillance and recommend approved strategies. Dengue is a reportable disease in the United States. Efforts are also going to be expanded to educate the public on dengue prevention. You know, we see a lot of scariness in the news as always, So we want to get good information out. That's why I'm doing this short sort of bullet program to get some initial information out to you in the fire EMS community. This brings us to the end of this segment of Let's Get It Straight to address dengue virus. And I hope that the information is helpful to you in your day-to-day activities, both at work and at home. If you have additional questions, please feel free to contact me at 703-365-8388 or send an email or contact me through the website. Once again, it's been my pleasure to present hopefully some very useful and basic information to you. Please watch for another episode of Let's Get It Straight. Thank you.